Hello, so this is a quick introduction to different ways that you might manage wounds in our minors department at Leicester ED. It is a bit of a quiz, so have a think about the answers in your head. If you're going to do it with more than one person, then you can talk to each other. So, first of all, think about how you would describe those wounds. There are lots of words that you can use when you're thinking about wounds, but you've got to remember what it is, where it is, think about measurements, including depth, and what you've done about it. So you're ringing some up a wound, and you know, first one you might say it's an abrasion, it's on the dorsum of the left hand, it extends over the knuckles, and it's superficial. That's important because they're going to want to know, is it deep enough to involve any of the structures below? And once you clean that up, you can probably be fairly sure that it won't. The other one that you might describe also as an abrasion, it's on the lateral aspect of the right cheek, extends over the right side of the nose, and again, it's superficial. What are you going to do about that? So abrasions are painful, and often they're not the only injury. So often, you know, somebody's fallen over and they've got an abrasion. They might have other injuries as well. They do need to be cleaned really, really carefully, and if dressed, it needs to be non-adherent. If you're going to refer this on to somebody as maybe, you know, having extensive skin loss or anything like that, don't forget a picture speaks 1,000 words. Our nerve center devices, most of them will take pictures, which then the receiving teams can see. It stores them long term, so you can use them to look at healing as well, and that's a really useful thing to do. Because abrasions are painful, if you're thinking about scrubbing them out, and that is why there's a picture of a scrubber there, you've got to think about pain relief. Could there be complications is what you should always think in injuries. And what could they be for abrasions? So you can get tattooing from abrasions. So what can happen is you've got superficial skin loss, you've got dirt there, and the skin grows over it, and the dirt leaves a permanent tattoo, because essentially that's what a tattoo is. It's in ink injected just underneath the skin that then the skin grows over. So tattooing can be permanent, so you need to be thinking about that really, really carefully. Obviously, if you've left dirt in there, that can cause infections. These can be painful and cause scarring. Abrasions should heal really, really well, but if they get infected, they may not do. Therefore, that's why you need your scrubbing brush. What about that? How would you describe that? So, as we say to toddlers, remember your words. Wounds with edges penetrated the skin. It's a laceration, only goes to subcutaneous tissue. It's superficial. If you think it might be an inflicted wound and somebody's going to know exactly how big it is, please do measure. How would you close them? So if they're properly open, consider glue or steristrips. Remember, glue holds the edges of opposed wounds together. It doesn't go in the wound. If you fill up the wound with glue, it just stops it from healing. The other thing to think about with wounds like that is that self-harm is a symptom of a problem and not the problem. Be compassionate when you're dealing with wounds like this, and think about how they're going to heal. So, when should you or shouldn't you use steristrips? So good times, superficial lacerations, edges are easily opposable on a nice flat surface where it's not going to be under tension. If the wound is actively bleeding, they won't stick. So that's a bad time to use steristrips. Overloads of hair, they won't stick. Over a joint, they won't stay. Over infection, they're not going to help healing. And bites. Just be careful with the bites thing. You may need to seek senior help on this one. So glue. It's easy, right? Right. Glue is easy and glue is great. We use it loads, but there are a few provisos. The wounds must be clean and dry. It's glue. It needs to stick. You can't apply it over joints because it's just not that strong. It's glue. It's not the same as welding things together. Don't put it over an infected wound. It won't heal up. It's glue. It's to close a wound. If it's an infected wound, it probably needs to stay open. Please don't stick the eyelids together. It's no fun, and definitely it does happen. We glue a lot of foreheads because they often come into the criteria of being in a nice flat surface that's not under tension, and you can stick potentially reasonably sized ones back together like that. However, what you need to do is lie the child flat, and there needs to be something over their eye. Please do get somebody to help you. Toddlers are difficult enough as it is, and genuinely, we do stick people's eyelids together if we're not careful. Please don't do it. But it is great, and we love it, and we use it all the time. So, when you're thinking about suturing something, what should be your first question? What should be your second question? So the first question should be, does the wound need suturing? So can we use something else? Is it somewhere that's not under massive amounts of attention? How important is this to heal from a cosmetic point of view? Is it infected? Is it difficult to pull together? And the second question is, should it be you? So we're really keen that everybody learns to suture. Definitely you should do your first few under supervision. But there are different degrees of capability with suturing. If it's on the face, if it's a complicated wound, if it's very deep, if it's going to need more than one layer, and you don't have the skills for that, then it probably shouldn't be you, and we should probably refer it on. Don't be afraid to do that. We do it all the time. The other thing that we can offer to people is that they come and do a bit more complex suturing under a bit of ketamine. Just be clear with them that it has to be a short procedure. So if it's really complex, it may need to go to theatre for a proper clean. Can you think of times where you would think twice about suturing? So if it's really big, does it just need to go to theatre? Is this a complicated orthopaedic thing? Is it likely that other structures might be involved that you just can't see and you can't explore properly? That needs theatre. That's fine. We can refer it on. Is it a facial wound? Does it need somebody with special skills? Does this need to be done really, really tidily? And are you up to that? If you've done max fax before and you've got great suturing skills, then that's absolutely fine. And we know that we have trainees who do. But if that's not you, then maybe it needs somebody else with special skills. We've all got special skills, but that might not be our special skill. Lip laceration. So this is a one that we see a lot. Does it involve the vermilia border? This is one of those ones that comes into category of this needs to be done really, really carefully. So this is an automatic max fax referral. That's absolutely fine, and they have no problem with it. They'll come in and see it, even if it is relatively small. Remember, you're talking small in proportion to the person, so it might only be a few millimetres across, but if their face is quite small, that might be quite big. And then bites. Have a think about, should it be closed at all? There's no definitive answer to this, just whether or not it's a bite, but if it's a puncture wound, probably not. You might want to leave it open. You're going to think about cosmesis, you're going to think about infection, you're going to think about all of those things, and it might be worth asking your senior. Can you think of times that you might need to think differently about how you're going to deal with this patient? So, special needs. Will the child tolerate what you're going to need to do? Should we use ketamine? So obviously we have a very low threshold for toddlers to use ketamine. We do a lot of ketamine sedation for minor suturing. Ask the doctor and nurse in charge whether or not that we've got the capacity to do that. We don't always. Do they need to be brought back at another time? That's absolutely fine, but we need to plan for that. If they are older and they've got special needs, you're not going to be able to just swaddle a 9-year-old kid with autism and ADHD. Not only is that not physically possible, but it's actively cruel. Sedating them is a better way to manage that situation. Is this wound complicated? Should you ask for help? Always just ask your ED senior first of all. We ask each other all the time. Is it too complicated? Is it borderline? Is it downright, well, no, I can't go there. Just ask one of us first, and we'll take it from there. So pain relief, please don't forget pain relief. We do have all the good drugs, and we should use them. Can you think of some of the good drugs that we might have? So lat gel. Lat gel is, I'm going to go through in the next slide, but basically it is a gel that goes in and around the wound that provides local anaesthesia. It stops you giving an injection to give stitches, which can be really good in younger children. Lignocaine injection, you can use that with lat gel, providing you don't overdose them on lignocaine. fentanyl, which we give intranasally. Sometimes we use diamorphine, it depends what's available, but that's definitely worth a shot. Entonox, so we have gas and air that we can train people to use. It's unlikely to be useful in a child under 4 because they're unlikely to be able to coordinate themselves well enough to get the best out of it, but it's a great drug. It's really, really great. It gives excellent pain relief, and you should definitely consider doing that. Remember, lots of these things aren't mutually exclusive. You can certainly give Entonox with Latgel or lignocaine with Entonox. If you think, actually that needs to be closed quite quickly, you can give them Entonox while you give them the lignocaine injection, get them nice and calm, talk them through it. Don't forget paracetamol, ibuprofen. They last longer than a lot of these other things, and it gets people in the habit of thinking they can just, actually, it's a big hole in your leg. It will hurt even when you've got stitches in it. Maybe you could use that at home. Don't forget the play therapists, involve them early. They'll often suggest different ways to manage the pain, and they're great at that. They are really good at keeping the children calm. They're also really good with the parents, and they'll make your life a lot easier. And of course, ketamine. Okay, we do obviously need to follow some kind of procedural guidelines with ketamine, but we do use it a lot, and you should definitely have that in your back pocket for things that are particularly complicated or particularly painful. You got to pick the pain relief with the patient and the wound in mind. There's no one-size-fits-all solution. And everybody will need different things. There are things that people find more painful than others. That's okay. We are aiming for distress-free. So distress-free and pain-free are not the same thing. You can be very anxious but not in pain, and we really want to manage all of that together. Just remember, particularly with younger children, they can be really worried about expressing pain. And so lying very still and quiet when you've got something, on your leg or your arm, which you think should be painful, that is an expression of pain. Don't be afraid to treat it. They may tell you they're not in pain, but if they're looking there and saying absolutely nothing, then I would be very worried that they are still in pain. So just a quick word about Latgel. It's, as I said, a local anaesthetic gel you can put in and on wounds. It can be used in anybody who's over 1, but the wound's got to be less than 5 centimetres long. There is a protocol about how to use it fully, and it is worth just having a quick flick through that. So if this was helpful, then just let us know. This whole thing is a bit of a work in progress, and if you've got any suggestions for content, then just give me an email. That would be really helpful. Remember, we're aiming for happy smiley faces on the FACES scale, not tears. That applies to you as well as our patients. I just want to say thank you to Jake. So those of you who don't know Jake is one of our multimedia technologists. He's amazing. He's designed all of these slides. And of course, Pam is one of our plaster technicians. She does lots of teaching on wounds and plaster. It is worth catching up with her because she is a font of knowledge, and she's let me use all her pictures, and I'm extremely grateful for that.